Dan. Goodness, it has been a while since I have updated. It's been about 3 months or something ridiculous like that. So it is, let's see, July 27th, August 27th. So about 2 years and a month on testosterone, and it has been a year and, see, May 15th, June, July, August. So a year and 3 months post-op. And also, surprise, surprise, I had a hysterectomy too on August 8th. So it's almost 3 weeks post-op on that. So let's just start from the beginning and start with changes from testosterone. Wow, I hear a lot of people saying at about a year things level out, and I think I even said that, but now at 2 years and a couple of months, I'm still noticing changes. It seems like my voice has deepened even more, and I think that partially it comes from me. My testosterone levels the last time they were checked are around 800, and they have never been that high, so I think that's the kind of difference that I need. I was at like 300 for most of my transition, and now it's at 800, so I think it's just kind of like, bah! Changing. So, my arms are really hairy, and I'm even getting hair on the back here, and it's like my armpit hair grew. Like, it came out even more. My facial hair, it is trimmed down a lot, and the light is crappy. Let's see. That's better. That's better. See, that's that side. Almost connecting right there. And then this side. Almost connecting there. Mustache is looking normal, finally. And it even kind of starts coming down here, but it's kind of uneven, so I shave it off. My hairline, don't mind the zits. The hairline has completely changed. Look at how far back it goes. My hair is not thinning, though, or really, receding or anything. That's good, because I thought for a while maybe I was losing some hair, but I'm not. So that is good. Let's see, my leg hair is crazy. Ah, darn this light. Look at all that hair. And even on my thigh and stuff. It's kind of crazy. Look at all that. The hair is everywhere. Maybe you can see my arm hair more here. No, not really. And then I can show you guys my chest. So, I haven't been able to work out because of the hysterectomy, obviously. But here's my chest. Year and a couple months post-op. And then if you want to see my chest hair, can you, I don't know, it's starting to get up here. I have like a little swirly of hair. Can't really see it, but it's there. I have a swirly of hair up here, and the hair kind of goes up to here. It goes down to my stomach and stuff. Looking good. Okay, now the hysterectomy scars, there's 3, because I had a laparoscopic assisted vaginal hysterectomy. So they did all the cuts from the abdomen, they blew it up with gas, and then they put a laparoscope through the navel, and then they put a suturing tool through one, and another tool through the, I don't really know, another tool through the other. So I have a scar right there. Now, I mean, it's still healing, it's pretty fresh. So this one had to be pretty big in order to suture things up. So there's that one. Then one of them's in my belly button. You can't really see it, I don't think. It's down there. And then this one's kind of lumpy. It's a puncture. This one's small. It's probably about 3 millimeters, but there's a stitch in there because it kept bleeding. So that's that. I I still have a couple of weeks of recovery for that one. So yeah, I've gained muscle in my shoulders. People at work here have been commenting. Somebody said, "Wow, did you play football because your shoulders are so broad?" I'm like, "What?" But apparently they are. Or my back. I guess I got pretty strong, and I'm not even working out because I can't. So, whenever I'm done recovering, I will start working out again. I did get a membership at a local gym, so I'll start that. Life has been pretty good. I'm advancing really fast at my job at the hospital I work at. I'm part of an electronic medical records team, and I'm doing all this crazy stuff. So, that's really good. Life is pretty good. I can't complain. Um, that's pretty much it. So, if you have any questions, comments, concerns about the transition process, let me know. I did not get my surgery paid by insurance. I thought that I was sneaky enough, and I sort of conned them into forgetting that little stupid clause about medically necessary, because I had my psychiatrist put medically necessary, and I thought that would be enough, but it wasn't. And I had my surgeon put that it was medically necessary and gave me a couple additional diagnoses to try and push it over the edge. But man, they are really, stingent with their diagnoses, and the insurance companies want their money, and they don't want to pay for anything that they don't have to, no matter what the circumstance may be. So they found a little clause about gender, they vetoed the whole thing. So, I'm going to get a fatty hospital bill. But you know what? Had to get it done. I was starting to feel abdominal pain and things like that too. So I didn't want to take any chances. So I just got it done. So I did not get mine covered. Yay! How wonderful is that? But it'll all work out. I'll pay it off over time or whatever. And what you gonna do? I strongly suggest to guys that have to do that. My surgeon fee was $2,500, and then whatever the hospital and the anesthesiologist, charges me will be an additional charge that I can work out a payment plan for. So, guys, you can find a OBGYN surgeon. It might be a little bit cheaper of a route than trying to go to a plastic surgeon, because an OBGYN should be pretty qualified to take out a uterus and ovaries and a cervix. I mean, they do it a lot more often. I don't think it's really a plastic surgery issue. It's more of a surgical issue, and it might be a little harder to go into that kind of office and be around a whole bunch of women and people not being, questioning you. But as far as cost-wise goes, it's going to be a lot less expensive, and you probably will find somebody a little bit more specialized in that area, so you're going to have a better result. So that's my advice for anybody who's getting it done. Just go with an OBGYN, try and find one that's pretty good, and then find out what their surgeon cost is, and then the rest you can figure out later. Or you could save up money, get an estimate from the hospital. Maybe with your insurance you can get that part of it covered. So that's what I would recommend to you guys, because I think everybody thinks because they're trans they have to go to a plastic surgeon, but you don't really. I mean, the histo part is kind of the easier part out of the two, because that you can find at a doctor more locally, and there's more doctors that do that. Now, as far as other bottom surgeries go, whatever, but ultimately you're going to have to get a hysterectomy if you're going to get any further bottom surgeries afterwards. So if you're considering getting bottom surgery or hysterectomy, I suggest doing the hysterectomy with a local surgeon. That's the easiest way I think to do it, and the most cost effective. So yeah, I guess this ended up being a lot longer than I thought. This is the longest update I've made in a long time, but I hope it was helpful. Like I said before, if you have any questions or comments, just send me a message, post a comment, whatever. Alright? I hope everybody's doing well, and hopefully I will make an update sooner rather than later. Bye.